I came home like I do every day, walked through my home and checked the barn and pasture for the horses. And sure enough, my horse Sal was in trouble. He was muddy, he had been rolling and stressed.
Welcome to our 2021 video series for Loomis Basin Equine. Many of you were with us last year in 2020 when we went through some really great educational topics, and we enjoyed talking with you and teaching you all about stuff. But one of the pieces of feedback we got is that we wanted to see more of the real cases and the real things that are happening at the clinic. And so this year we have something really great and just a little bit different for you. It's going to be the same educational content that you guys appreciated last year, but each piece is going to be essentially a story about a case or a horse and one of our clients. But with that combined will be an educational piece where you can learn about a specific disease and what's happening. This first one that we're doing today is going to be about colic, which everybody knows and is familiar with. But what we want to teach you about is basically what kinds of things that you look for, what kinds of things could happen, and then how we potentially manage that type of problem and help you guys through it.
Hi, my name is Barbara Mancia. I live in Cool, and I came home from work on Friday the 12th of February, walked through my house out to the deck, looked out at my barn to see my boys, and something was terribly wrong with Sal, my trail horse for 7 years, and I immediately went down to the barn, and sure enough, he was rolled in mud and in pain. It was time to call the vet.
I got the call from the front office Friday afternoon. It was around 4 o'clock-ish. They let me know that Barbara's horse Sal was colicking. So I called Barbara and let her know I would be there probably in about 20 minutes. When I pulled in, I could see that Sal was down and getting up and down, pawing, rolling. On Sal's initial physical exam findings, which were really limited because I had a very short window of time where he was willing to stand up because I asked him to and gather a few pieces of information, his heart rate was around 64 beats per minute. Normal in a horse is 30 to 40, and with Sal being a fairly athletic Arab, I know his resting heart rate is usually low end of 30, sometimes even 28. Because he used to be an endurance and ride and tie horse. So Sal having a heart rate of 64 was very alarming because that's one of the parameters we use to decide how serious a horse's degree of pain is and how severe the colic might be. He also had really limited to quiet gut sounds on the right side of his body and absent gut sounds on the left, which was another thing that made us pretty worried. He tried to stand there to let me give him the medications. Even in that short period of time of asking him to stand for 20 or so seconds, he was starting to get restless. So we gave his couple of injectable medications literally sort of while he was walking in a circle. Once those medications were in him, he settled enough to at least be able to sort of stand and get his bearings and literally start catching his breath because he had been up and down rolling pretty dramatically for at least an hour or so at that point. Once he was a little bit more settled, I went back to my truck and got buckets together and everything we would need to pass a stomach tube and do a rectal exam. Sal was lightly sedated at that point, but for the amount of medication I gave him, that would make the average horse pretty sleepy, like nose at least halfway to the ground and like really not care about anything going on. And that's how he had been the last time that he colicked, which was a full year ago, where that amount of medication was enough to just totally take his edge off and he didn't care about anything in the world. This time was different, where he still had his head up and was looking around and looked anxious, like you could tell he was still in pain and pretty aware of his surroundings, even though I'd given him some pretty good pain medications. So I gave him another dose of sedation to make tubing safer and easier. So he got a second dose of pain medication within probably 15 minutes of getting his first pain medication. And that was kind of our point two or strike two for another reason I'm thinking this horse probably needs to go into the hospital. Usually one dose of sedation is enough to take their edge off, and your average garden variety colic is going to be standing quietly and happily after that because you've relieved their pain. After giving Sal the second dose of sedation, he was at least sleepy enough to let me go ahead and pass a tube. What we were looking for was, does he have fluid backed up on his stomach? At that point in time, I was really worried that his stomach might be distended. Horses in general don't vomit or can't vomit without help. And so if a horse has an obstruction or blockage in some place, that can cause their stomach to become really distended, dangerously full, and in worst cases rupture. So priority number one for Sal was getting a tube passed to make sure that he could off gas and let fluid off if he needed to. At that point in time, he did not have any reflux, which is kind of the doctor word for vomit, which was good, although we suspected we were catching something pretty early. Sometimes if we catch these guys early, they can have an obstruction, but not yet have things backed up far enough kind of up the chain to have extra fluid in their stomach. Sal ended up fitting into that category. And so at that point in time, I just gave him some water and electrolytes, warm water and electrolytes, via the tube to see if we could stimulate things to kind of get moving and help with his hydration status. And then we did a brief rectal exam. As we were sort of finishing that up, and all those things take less than 20 minutes, I would say, Sal started to paw again, and Barbara and I had been having the conversation about our general level of concern. My recommendation was to go ahead and load him up and bring him into the clinic so we could do more diagnostics and make sure he was in the right place to get the help that he needed if he ended up needing it. I went ahead and called Dr. Diane Rhodes, who I knew was on call that evening, and let her know that Sal was headed her way. I also let Barbara know to go ahead and call us when she got through the canyon and onto 80, so we had a good 10-15 minute warning about when he would be pulling in the driveway and could have everything set up and ready to receive him. We also talked about the importance of leaving him loose in the trailer. It's always scary to put a colicky horse in a trailer, but our recommendation is to give them as much space as possible and leave them loose. And if you hear or feel them lie down, keep driving and get them to the clinic while driving as safely as possible, and we'll handle it when they get to the clinic.
I was at the clinic. Sarah Mercer had given me the call that Sal was on his way along with Barbara. So we were here ready to receive him when he got here while Dr. Mercer ran some blood work. We examined him and he was definitely still very, very painful. So we were having to give him quite a bit of sedation to keep him comfortable, but we had a great crew, so we were clipping him for the ultrasound while the blood work was running. And the main finding was on the ultrasound that he had some pretty dilated loops of small intestine. So we were already worried that it was giving us some red flags that he might need to go to surgery. So after the ultrasound, we went ahead and did what we call a belly tap or abdominocentesis. And sure enough, our fluid was very suspicious for what we call a strangulating lesion, meaning the blood supply was getting close to being cut off from the small intestine, which is definitely an emergency that requires surgery. So while the belly fluid was running and we were waiting for those numbers, we did shoot just a couple of quick x-rays, make sure he didn't have any concurrent diseases, particularly sand or stones, that we would also have to worry about at the time of surgery, so our surgeon wouldn't have any surprises. And once we got our results back, given what we found, we did decide to take him to surgery. So we called Dr. Major and our crew and basically got him on the table right away.
I heard from the medicine team and emergency team that Sal had come in and was experiencing colic, and that was pretty severe. Something we see almost every day. Not every horse goes to surgery that has colic, obviously, but the ones that come in that are very severe, the number one indicator that they need to go to surgery is that they're painful, and he clearly was. So I walked into the room and he looked really bad. He was very sick, clearly, very dehydrated, painful. And once we had the results of all the diagnostics that Dr. Rhodes and the team ran, it was clear that we needed to put him on the table and see what was going on in there. So at that point, we put him under anesthesia, got him on the surgery table on his back, made an incision into his abdomen, did our abdominal explore, and Obviously, there's a lot of intestine to go through in the horse, and we knew almost immediately the small intestine was affected, and that sort of coincided with the findings from the pre-op workup. Looking through them, there was clearly the intestine was trapped somewhere, but I couldn't quite find where. And after about 20 minutes of working on it, we realized that there was a lipoma that was, which is a fatty tumor on a stalk that grows off of the connective tissue of the intestine, and that had actually wrapped around the very end of the small intestine where it sort of empties into the large colon, or the large intestine. So after manipulating that for a little bit, we were actually able to reduce that entrapment, bring the lipoma out, tie it off, and cut it out, and then further exploration of the intestine actually showed that it was still viable. So due to the expediency of actually getting the horse in here quickly after the workup by Dr. Mercer, a quick pre-op workup by Dr. Rhodes and the team, and getting on the surgery table very quickly, we sort of relieved the strangulation before the intestine actually died and required resection and then having to be put back together. Once we determined that the intestine was still viable and didn't need resection, we were able to perform the rest of the abdominal explorer. No other abnormalities were found with any other parts of the intestine or other organs. At that point, we closed him up, moved him to recovery, and were able to do it quite quickly. He did well through anesthesia and stood up really well in recovery. Actually recovered very well, especially for an older horse after going through such an ordeal. So at that point, he went back to the ICU, and the internal medicine team with Dr. Rhodes took over his care at that point. And after surgery, obviously they need some supportive care and that sort of thing. So we went back on some IV fluids and a slow refeeding program. And then over the next couple of days, as he was able to come off fluids, drink for himself, eat, and then able to pass feces, he was actually able to go home several days after colic surgery, which is pretty quick. So about the best possible outcome as we could see for Sal, and then he went home to Barbara, and Dr. Mercer then took over the post-operative care at that point, where he'll go back in rehab for the next couple months from his surgery.
So after the team decided that Sal was ready to come home and be back under Barbara's care, we sent him home. He was at that point on full feed, and then we communicated regularly with Barbara about how he was doing and how to continue tapering things like his Banamine and making sure he was eating. How did Sal seem when he got home, Barbara?
Oh, Sal was very happy to be home, and the care was amazing, and the communication. I was constantly being texted by Dr. Rhodes, by Dr. Fielding, obviously Dr. Sarah here. So my husband and I, we took turns, hand walking him, watching his feed. So he's off everything now, and he's eating and grazing and pooping and peeing, and we're all happy.
Making the decision to send Sal into the hospital for more diagnostics that night was easy because we already knew he was enrolled in ECProtect, and there would be no emergency fee for him getting after-hours care. Barbara, how did being enrolled in ECProtect help you as far as making the decision when it came time to decide if we were going to put him on the table or not?
It was a huge help to me because it was a financial chunk I didn't have to worry about. We've been very good about staying on the plan since, for years with Loomis Basin. And now that I needed to use that plan, it was a huge help. And, we was taking a chance for surgery. We didn't know what was going on until it was opened up, and we lucked out, and we're happy we made that decision.
Hope you guys enjoyed and appreciated the video today. We really want to emphasize in this video how important colic is, how important it is to recognize colic, but also how much now with the new advances in medicine that we can do and how we can have these great outcomes. It's really important to remember though, however, that some of the outcomes are not so good, and it can be a really scary process, and it's one of the things that us as veterinarians can be there to help you and help you work through. You also got to learn a little bit about Equine, which is one of the really important programs that we have to help you guys make these decisions, and our goal with that program is to take finances out of it and make it something where we can just do the best job for the animal and don't have to take that into consideration. If you enjoyed this, I hope you'll hit like and subscribe on our YouTube channel so you get a notification each time we have one of these videos and you can share these stories with us.